Hi folks, how you doing? Kenneth Kerr here, Esterhazy Online, and welcome to a brand new feature. I'm here today in Pharmasave, right in the middle of Esterhazy, and we're going to have a new concept here. You can kind of call it Ask a Pharmacist. Whether we call it that eventually, I don't know, but you get the idea, because sometimes you'll have questions that you want to ask somebody, and you don't always want to come right into the store and stand at the counter and talk with someone, because number one, you might be embarrassed. Number two, you don't know who's standing behind your shoulder, right? So this is a way that you can send questions to us anonymously that you would like answered. Okay, now again, bear in mind just something here. If something really serious, talk to your physician. Okay, that's important. But in the meantime, this may be a service that you find useful and entertaining and helpful. We certainly hope so. So without any more ado, Ryan, how you doing today?
Doing great.
You're doing great. Good, good. We've picked our time. It's nice and empty here. Big place, by the way. You know, you don't realise it always. You know, some of these shops, when you see the frontage, you know, you don't realise how far back they go. And this is one of them.
We've got a little bit of everything.
Wow, that's great. So today you want to talk about something that you've had some questions about.
Well, we get a lot of questions about the condition of shingles,
okay.
Which a lot of people are pretty familiar with, or they know someone who's got it.
Yeah.
Just as a general description, it'd be categorized as a painful blistering rash. A lot of people describe to me it being like a burning or a pins and needle sensation.
Wow.
Now, the pain itself can last for months or even years if it's not treated properly. Now, having said that, then the question is, well, what causes it? Shingles is caused by the chickenpox virus. Now, it's generally lies dormant in a person's system, or inactive, and then years later, it'll activate itself.
Okay, so if somebody had a vaccination for chickenpox years ago, is that something that's likely to impact it at all?
It may or it may not. It all depends on a case-per-case situation.
Okay.
Now, having said that, 95% of all Canadians have had chickenpox.
Right.
Now, there's also a lot of people who are exposed to the virus and carried in their system and have never presented with chickenpox per se, but are still at risk of getting shingles.
Right.
So the whole key to treating it is to do it as soon as possible. Antiviral medications should be started within the first day or two of when the burning sensation or the rash starts to appear. You definitely do not want to delay that. A lot of people come into the pharmacy and we will kind of help them along that way to direct them to the physician to get it taken care of as soon as possible.
Yep, yeah. Now, I would think, you know, as I'd said a few minutes ago there, kind of in the introduction, it's important then that people, no matter what the condition is, you know, if they've got this rash, this blister, whatever it is, and it's painful, you would certainly recommend, even if they came in here right off the street,
absolutely,
you'd probably recommend, I suggest you go talk to your physician.
Definitely, but we can definitely guide you in the right direction, because we've seen a lot of people. I've seen people come in, oh, I've had this painful rash for quite a while, I'm not sure what it is, and then the main alarms go off. We need to get you treated as soon as possible.
Yeah. Wow.
The question we get coming with that is there a cure for shingles? And the answer is basically no. There is no cure, but now there is a vaccine available, which a person can get, which protects a person against getting a shingles outbreak.
Okay.
Now, the vaccine, it's indicated for people over the age of 50, generally because at that age and beyond is when most shingles cases appear. But having said that, I have seen cases where younger people than that do get the condition, or shingles do show up as well. It's very dependent on the individual.
Yes, yes.
One of the most common questions I get from people that have heard about the vaccine is, if I've already had shingles, can I get the vaccine? The answer to that is yes, and in fact, I've even discussed it with the company that produces the vaccine, and they said that the majority of people that get the vaccine are people that have had shingles, basically because they know how terrible of a condition that it can be.
Yep. So how debilitating can it be? Is it just because it's painful all the time, or does it get itchy and people scratch it as well?
What it does is, when it first appears, it is a very painful rash.
Yes.
Now, some people don't think much of it. What happens, though, is it actually can cause neuralgic nerve damage, and then you're left with this neuralgic pain, which I've seen it last 20, 30 years for people. Now, the thing is that it is very difficult to treat at that stage. There's not a whole lot you can do, so prevention is kind of the best medicine for it, or treating it as soon as possible. I mean, it's not that, as far as getting the vaccination, it's pretty simple.
Yes.
Person basically just has to go to the doctor, get a prescription,
Yeah.
bring it into us. We'll supply you with it, give you whatever information you need. You just have to go back to the clinic to get it administered, and that's pretty much it.
Okay, so most people come and they think about this when there is a rash or something beginning.
Exactly. I mean,
so,
now...
And is that the best way, Ryan? Is it, you know, rather than the whole population running in and saying, I want this vaccination just in case? What's the typical advice?
Not necessarily. I mean, we have a more aging population.
Yes.
The biggest group is the baby boomers.
Yes.
And they're in the age when... That's the age when shingles generally appears. So pretty much everybody knows somebody that's had it.
I see.
And they know what it can, how bad it is, and they don't want to get it. So, I mean, as far as getting a prescription, a lot of people are seeking it, seeking the vaccination because they don't want to end up
so
in that
it is
situation.
Something a person can be proactive about as opposed to waiting for it to happen.
Absolutely, yeah.
Okay.
I mean, there's really not too much to it. If a person has any other questions or concerns with shingles, the treatment, anything like that, just pop by, give us a call. I mean, come down, ask us any questions you want, and we'll provide you with every info, with whatever
information you need.
Exactly.
Well, I mean, that's the thing. I mean, you're here as not just a source of product, you know, which obviously you have a tremendous selection of different products here, as we'll explore from time to time, but you're here also as a source of advice.
Absolutely.
You know,
that's what we do every day.
Awesome. Great. Well, listen, I really appreciate you taking time for this today, and remember, folks, you know, you can send questions. As I say, you don't necessarily have to identify yourself. That's not what this is about. We want to provide a service as an extension of Ryan's service here at Pharmasave Esterhazy. So thank you for watching. We hope this has been helpful. Take care.